Hi, welcome back to my channel. My name is Kayann and I really appreciate you stopping by. Now, this channel talks about different aspects of my life, different things that concern me and so on. So the last time I made a video about being pregnant in the COVID-19 pandemic and also having fibroids during the pregnancy. Now today I am, as the title suggests, I'll be talking about my experience at the Cornwall Regional Hospital in MontegoBay. Now, my daughter is now 3 months old, almost 4 months old. She's basically 3.5 months old, and she's doing well. I'm very grateful for that. Now, at the Cornwall Regional Hospital, I went in a week before, almost a week before I gave birth to my daughter, because when I went for my routine checkup at the clinic, my blood pressure was a bit elevated, and so because of that, and I was in a late stage of my pregnancy, I was also due for C-section and so on. I was 38 plus weeks, right? Basically 39 weeks. I was 39 weeks when I went in. So they decided that they were going to admit me to the hospital just in case, just for observation and to prepare me for my C-section if needs be. When I went to the hospital, the first thing that was done, they take all the information about you. They take your maternity book, records and so on that the clinic sent up, and they took all of the details, the basic information about you, your age, or your blood type, and all of these things. Now, there was a doctor there, specifically there. She was at the entrance. She was a very lovely woman. Well, she was a very lovely professional, but also warm doctor. She was an intern as well, so she was the one who did the COVID-19 test on me when I arrived. The same, like a few hours after I arrived at the hospital, on the maternity ward. So they were doing all of these procedures just to prepare for the surgery, my C-section and so on. And I believe all the mothers, I'm not sure if all the mothers were tested, but I know that they said to me that if you're coming in for a surgery, you will be tested, because that means you will be admitted to the hospital. I'm not really sure but I believe most of the mothers were tested that were entering the hospital there, since they were going to be on the ward with the other mothers who were there with their babies or who were waiting to give birth. Okay, so after the COVID-19 test, it was very uncomfortable. Yes, the tube the swab thing went through my nose down, and another one went through my mouth down to the back of my throat. So yes, it was a bit uncomfortable, but it was bearable. The doctor explained all of the steps to me, what she was doing, and she assured me that she's just following protocols and she just wants us to be safe and everything. So, I felt very comfortable with her. Now, after the COVID-19 test, and they took all the details and they told us what we could keep with us on the ward and what could not be kept on the ward and so on, all the information. And they gave me some advice about the elevated blood pressure, since it was the first time they have experienced that in my pregnancy based on my records. So they were watching it, and they were saying to me that they will probably have to do my C-section the day after. So I was there. I wasn't really, your mind is set on a certain date, your due date, or near to your due date. Since you're doing a C-section, so therefore you would not wait until your direct due date, but you are set on this time, right? Your mind is prepared and everything. So I had to ask my husband to take my maternity bag to me and all of that. He had it in his car, so he came back from work, came by the hospital and dropped off my maternity bag, my hospital bag, I should call it. No, I had my nightgowns, my baby change of clothes and all those things, maternity pads, and underwears and all of those things that were needed for giving birth at the hospital here in Jamaica. If you need me to do a video about that, about the items needed to give birth here, please leave it in the comments and I will do that video as well. Okay, so in the night they came back and they checked me. They gave me I was basically on this special type of diet, low sodium, but most of hospital food is already low sodium, but because I was being watched and so on, so after that night the nurse came and they did their routine checks on the patients, and she took my blood pressure. It was still elevated. I was warned. I was told that it needs to go down. I need to stop whatever it is that I'm worrying about, whatever is happening. I need to, So the next morning, the doctors came about 7 a.m. To do the ward review or just to check the patients that are on ward. So at that time, they said that they had some cesarean surgeries scheduled for that morning, but if anything, I would also be one of the surgeries for that day. However, it didn't work out because there were mothers who came in on emergency, so they had to go straight to theater. And since I really wasn't an emergency, since my blood pressure was fluctuating, but it wasn't too bad, and I think they gave me, I think on that day or the third day, they gave me high blood pressure meds, some pills, but it was just like one pill or so, and it was taking it down a bit, right? So after all of that, the next day, I was scheduled for the C-section again on that day. Again, it did not work out. I was delayed again. But what I should say is, within all of this, the nurses, they wore their protective gear. They handled every patient with care, and they ensure that they follow the protocols for COVID-19 in the hospital. That's what I think. Because they wash their hands after each patient, after going through each patient's documents and so forth. They would sanitize, wash their hands after touching anyone, or even touching the thing with your information. That's the docket that they call it, with your information. They would do all of that. They wore their mask. All the patients, we had to wear masks on the ward, except for the babies, but everyone else we had to wear masks. And the workers who came to clean the floors and everyone, like the housekeeping sections and so on, everyone, they were wearing masks. And they had some wash hand areas not very far from each other. So if you step probably a couple of feet down on the ward, there would be another wash hand area. So all of those items were set in place for the COVID-19, and I really appreciate that, because as mothers, you're going in to have your baby. You don't want to be worried about catching this virus at the same time, and you're worried that maybe your baby will probably get the disease or the COVID-19 as well. So I was happy to see that they were trying to follow all of those protocols. The doctors, they were wearing their suits and everything. So well, most of the doctors, they would wear their, not only their face mask, but they would wear a face shield as well. They would use their sanitizers, their hand sanitizers, and so on. And they washed their hands very regularly. Paper towels were out, and all kind of things were provided for both the patients and the workers, nurses, doctors, all the workers there. So it wasn't a bad experience. When I finally got my cesarean, I was handled gently. I will say that, and I really appreciate the doctors who were in my surgery. I just want to. I can't even express my gratitude enough for that surgery and how it went. Now also, after the surgery, the ladies who came to, the first evening after the surgery, you're in so much pain, cesarean. Those of you who have experienced that, so much pain that you can hardly move your own body on the bed and so on. You're under pain meds and everything, but also the ladies will come and they will help you to clean yourself and all of that. Those ladies, they are God sent. They treated me well. My experience was good with them, and they were very gentle. So I just want to give God thanks for that as well. So my experience, all in all, it wasn't a bad experience. They followed the COVID-19 protocols, and I even remember one mother was there who was, I believe she was in quarantine. She was in a room by herself. Yes, she would share the restroom with us, but she waited basically until most of us were back into our area where our beds were before she would come out and all of those things. And after she came out of the room, there were 3 persons who came and cleaned, sanitized, and everything, the room in suits. So I must say that they did a very good job, and I just want to say God bless them for what they did, and I hope that they continue to be motivated, hope that they continue to be safe, and everyone who goes there, they are safe. They go there with their intention to come out with their babies and everything. I hope that they do, and everything will be okay. All right, so thank you for watching this video. If there are any questions, I'm not even sure if I left out anything, but if you have any specific questions, please type in the comments below, and I will respond as soon as I can. Thank you.